Medical presentation. What is type 2 diabetes mellitus? Let's take a look. What is type 2 diabetes? It is a metabolic disorder in which human body can't use energy from food properly. Human pancreas produces insulin, which helps human cells to utilize sugar, but over time pancreas makes less insulin and the cells resist the insulin. This causes too much sugar to build up in the blood. People who are at their middle age and older people are more prone to have this type of diabetes. That's why it is called adult onset diabetes. But type 2 diabetes also affects kids and teens, mainly because of childhood obesity. The main difference between type 1 and type 2 diabetes is its etiology, or we can say the cause of disease. In type 1 there is an autoimmune disturbance, which in type 2 body cell of human have developed resistance against insulin hormone. In type 1 human body cannot make insulin, but in type 2 human body does not produce enough insulin or the body become resistant to it. Type 1 diabetes can develop during childhood but also can develop at any age, while type 2 diabetes can develop at any age but most common in adults over 45 years of age. Diet, exercise, medications and lifestyle changes cannot reverse type 1 diabetes, but all these can help the body to produce insulin hormone in a body effectively, thus helpful in type 2 diabetic patients. In type 1 diabetes, beta cells have been destroyed, while in type 2 diabetes beta cells become weak over time course and due to age factor 2. Type 1 patients become dependent on insulin for the rest of their life, while in type 2 diabetes insulin injections may be required at some point. Family history is one of the major risk factor in type 1 diabetes, while in type 2 diabetes obesity, laziness and inactivity, high blood pressure and family history can be a risk factors. Type 2 diabetes is the most common form of diabetes. About 1 in 10 Americans have the disease. It's the 7th leading cause of death in the U.S. It mainly affects Black, Hispanic, American, Indian, Asian American or Pacific Islander. Type 2 diabetes develops when the pancreas makes less insulin than the body needs and the body cells stop responding to insulin. They don't take in sugar as they should. Sugar builds up in your blood when cells don't respond to insulin. This is called insulin resistance. Lifestyle factors including obesity and a lack of exercise. Genetics or abnormal genes that prevent cells from working as they should. Other causes are high blood pressure, pancreatic disease, stress, old age medicine, unhealthy food, unhealthy lifestyle, or we can say sedentary lifestyle. Do subscribe for more information on medical topics. Stay tuned and subscribe our YouTube channel.